Welcome to Health Talk. Today we're going to talk about losing weight and feeling good while we're losing weight. We have with us Kimberly Pham and Kim Charles. And we're going to start off with saying how difficult it is to lose weight. We understand that and that it is a problem. We look at Oprah Winfrey. She loses, gains weight. And it's a common problem for all women in America, especially after childbirth, having children. It's tough. So what do you think? Have you had family members and friends have this problem?
Yeah, I have. I had a friend who was having trouble with her weight, and I had to support her, obviously. You know, she's a close friend. It's not only a change of, oh, I'm just going to go for a run 10 minutes and change my diet. It's a complete lifestyle change. And I have tried my best to, try to eat the same thing so I can myself get in a little bit of better shape. But it's extremely difficult. Sometimes you feel like you keep working out and you work out and you don't see any immediate changes. And I think that's when it really knocks people down. And I think people feel less motivated when they don't see immediate change.
We live in the internet era where we feel that you press a button and you see Google information right away. So you think, okay, I changed my diet today. I should see some immediate change. And what happens is that your hypothalamus in your brain has a set point, and they're used to this weight. And so once you change the weight, it's hard for your hypothalamus to reset. It takes time. So it's hard for your brain to set all the chemicals in action. And part of eating is people like eating. It's a sensation. Taste is a sensation. And as it's hard to change your taste buds in 6 months, it's hard to change your wanting to have a different diet. Like if you're going from eating mashed potatoes to eating raw food diet, it's a change. Yeah. So you were looking at some research about it. Tell us what you think.
Yeah, so I read an article about how to lose weight recently, and they were talking about how it's important not to just change your diet, but also to incorporate a new exercise regimen, in addition to that. So eating healthier, eating more fruits and vegetables, like cutting down on salt and starches. And that's pretty hard for some people because, people are used to that lifestyle every day.
Yeah. Especially Asian cuisine is high in salt. Also McDonald's is high in salt. So if you're used to McDonald's, Burger King, you're used to a certain amount of salt. And what happens is that that's very difficult to change. And it's so part of fast food diet. That's why in New York City, the mayor there changed a law that they stopped serving certain large container of sugary drinks in the movies and all places, and there's a big cry about it. And he also was one of the big leaders in making McDonald's label all the ingredients. So is the First Lady Michelle Obama labeling all the ingredients, the fat content.
Yeah, wow. So when you decide that you want to lose a few pounds, what is a good way to go at it?
Well, it's harder to lose 5 pounds than it is to lose 20.
No way, why?
Because 5, your hypothalamus is set so close. It's so hard for you to sort of recalibrate. And losing 20, you lose the first 5 of the 20 from water weight alone. So it's all how you are as a person. And it's, again, behavioral modification. You know how sometimes people have to say, I really want to do it. Because obviously when they're ready to do it, they'll do it.
Yeah.
It's a very tough thing.
Yeah. So, so if people start working out because they're losing weight, doesn't muscle weigh more than fat?
So there's a combination. People work out, they feel better, and muscle weighs more than fat. And sometimes they eat more to compensate. So it's even harder to lose weight. So you have to change the type of diet and working out. And to lose 500 calories, to work out 500 calories is a lot. That's like 2 hours. Nobody has 2 hours to work out a day if they're working or if they're a student. Or if you're chubby, it's hard in your joints to work for 2 hours. You're not that mobile. It's very hard. And weight loss helps your mobility because if you lose weight, you have less pressure on your knees and your joints, and it's easier to move. So actually, it's very much related to health, diabetes, heart disease. The lower the fat content in your blood,
better.
the cholesterol level. And we talked about diabetic who are also at risk for heart disease. They have something called the metabolic syndrome. So you can have any of these 5 risk factors, and then you're at risk for diabetes or heart disease. For example, if you have cholesterol greater than 200, triglycerides greater than 150, for men, waist circumference greater than 40, for women, waist circumference greater than 36, blood glucose greater than 100. All of these, you have 5 of these, you're at risk for diabetes. And so if you have high cholesterol and you're chubby, you're already at risk. So it's very important. That's why Michelle Obama had this initiative for teenagers to get out for more movement, to get McDonald's, Walmart to sell healthier foods. Because if you're in low-income areas where there are highest epidemic rates of obesity and diabetes, they're not getting fresh fruit, vegetables. They're eating processed food, high fructose cornstarch, all the corn syrups. That really adds to the sugar load and diabetes, the risk for diabetes.
Yeah. So I've noticed that, I don't know, but I've noticed that a lot of younger generations, like the teenagers, for example, they really are struggling with obesity. Is that just because they're eating unhealthy, or genetics?
I think that they did studies the last 4 years. That's been one of the initiatives of the Obama administration. They found that teens are less active because many of the school budgets cut out physical education. They cut out gym. So the teenagers no longer work out even at school. And then if they're just studying, and then their parents, everyone's working because of the recession, people have had a tough time this last decade. They eat more processed food. They're saying that 85% of the American public doesn't cook, or they cook using processed food, or they just microwave it. So nobody makes, a low percentage makes a meal from scratch, like where they actually buy the vegetables, buy the meat. More people buy frozen entrees and add few leaves of basil on it and pour some salt or some pepper, and that's it. I mean, the only thing they'll add is maybe they'll toss in some fresh string beans in a can of soup.
Wow.
That's true. I think that also has to do with like, you know, how certain areas like have less resources than others, and like some live in more like impoverished areas. You know, they have less time. Like the parents are working constantly, like they don't have time to come home and cook like a home cooked meal for their kids. So they end up going out and going to buy fast food, or going out to buy, you know, like frozen foods, like you were saying earlier. So
And McDonald's hamburger is $1 or less. So you can actually not, you know, be able to feed your family for very little. And if you're very poor, some elderly people subsist on dog food and McDonald's because dog food is cheaper. I mean, they run studies because their Social Security check is so low. And if some obese people are elderly, and they have high blood pressure and diabetes. So for them, they're eating processed food. They're too infirm to exercise. So it's very hard to lose weight. So we wrote a book called Exercise for Everyone. And here in this book, we have exercises where you can be seated in a chair like this, or in bed, as long as you do some activity. And you can use water bottles to lift up your arms, to do it 20 times each time, or take a towel and pull on it. Some exercise is better than nothing. So losing weight starts with changing your diet and exercise. It's also behavior modification. There have been studies showing that people who gain weight have depression, have some maybe short-term depression. Some psychological studies have gone on to say they have some sort of schizoaffective disorder because they deny the fact that they're very big. It's like anorexia. They deny the fact that they're skinny. So it's almost a form of a mild mental illness.
Wow. And I'm guessing that when people are depressed, they're prone to eating more?
It is a sensation. You know, we have 5 senses,
Yeah.
touch, hearing, sight, sensation, pain. and how we stand. So therefore, it's a sensation. It's a positive sensation. You know, people like tasting sugar. It's an endorphin. It goes up to the same, close to the opiate receptors for morphine and heroin. So it's a addictive disorder. So people who like food, who are addicted to food, have addictive disorders. You know, they would then become addicted to something else, or they overdo one thing. You know, they either over-exercise. There's something called exercise bulimia, where they eat a lot and they exercise a lot to compensate. So it's all a kind of, again, it works on the various receptors on your brain, pleasure receptors, and there are biochemical reactions to why people crave food. You know, it gives them a positive feeling. It, you know, tastes good. Chocolate tastes good, vanilla tastes good, candy, sugar, it gives them a high. And people like that high, so it must be a way of self-medication.
Yeah. So this book is good for people who can't walk,
who are in wheelchairs, the elderly, extremely obese. And we have these patients in our clinic who are severely diabetic, and they need to lose weight because they will need bypass surgery. They need laser surgery done to their eyes because they're already bleeding in their eyes. Did you read about behavior modification techniques too? Did you, in your research?
Yeah, so like they talked about some things that you can do, like so you were saying how earlier how eating is sometimes tied to emotions, and so they were talking about how you can like be more aware of that. You know, like put down a log, like whenever you're eating something, you know, like actually record how you're feeling at that time. Like, do you feel satisfied, or do you feel like does it make you feel better after eating this food? And like knowing about these things, like actually you're more aware of it, and so like that helps you change your behavior in some ways.
Also, some nutritionists who work with people for weight loss, they ask them to write a log about everything that goes through their mouth. That log, the fact that you have to record everything, makes them conscious of how much they're eating. Because before they're not conscious, because what if you're snacking, you're running and eating a candy bar between classes, between work, in the coffee break, whatever. You're not keeping track. But once you keep track, you add up all the calories, you think, oh my goodness. And also Nike and some other exercise companies have wristbands that count your steps, count your calories, and they count everything, which is like an electronic way of keeping a log.
Is obesity more common now than it was, say, 40, 50 years ago?
They say that more people are obese at the average BMI, which is a measure of your weight to height ratio, is greater because people are eating more because the portions are bigger. They're saying that the portions are 30% bigger in this decade than 1960. So when you go to a restaurant, they're feeding you more. They're charging you more, but they're feeding you more. People have these giant portions, and they should just take them home. But it's very hard. But people do feel better once they lose weight. Once they decide, they hit rock bottom, and they decide that this is what they want to do, they lose weight. They feel better because they can have more energy. They breathe better. You know, if you have less weight around your lungs, you breathe better. You can run better. You can walk better. You can walk up and down the stairs without huffing and puffing. And you start enjoying that. And then it becomes self-fulfilling, that it is a cycle that's very positive.
Do you see any correlation, like in your own patients, with like weight and like some like the condition of their eyes? Do you see anything?
We see if they're diabetic and they're in bad control and they're chubby, they have some weight problem, it hurts them. But once they start even losing 5 pounds, they lower their blood sugar, lower their hemoglobin A1C, and they get significant changes in what's happening in their eyes. So what happens is that in diabetes, we look at their fasting blood glucose, and we look at their hemoglobin A1C. That's their 6-month report card. And we don't even have to look in their eyes. If those numbers are high, we already know there's disease in the eye. So once we see the disease in the eye and the fact that they have weight issues, usually then they have cholesterol issues and hypertension issues. So the weight loss helps their cholesterol, helps their high blood pressure, it is globally healthy for them. It's much better for them to lose weight.
Are all obese people likely to have diabetes?
There are some obese people who do not have diabetes. They're rare. It's a low percentage. But obesity, it makes it hard because you have all this fat deposition around your pancreas, which is right here in the midline. So if your fat deposition's around the middle of your gut, it's harder for your pancreas to release the insulin it has and to go out to the other parts of your body. If you have obesity, they have so many other things, like the risk for gallbladder disease, for having high blood pressure, heart attack, stroke. So it's important to lose weight.
Wow. So when you're overweight, do you get fat around your heart or anything
Yes, you
like
get
that?
deposits of fat. So once we had on our show Health Talk, we found that the 5 pounds of chicken fat was like this big, was the size of half a pillow. So that's what 5 pounds of fat looks like. So imagine that all over your body, around your heart, around all your blood vessels. Now, there have been finding in obese teenagers that their liver is fattier than teenagers who don't. They did biopsies. And so it's amazing. So there are things that are happening even as teenagers. It used to be thought that if you were just chubby in your teen and you lost it, you're fine. And we concentrated on adult obesity, people, because they would be most likely to get diabetes. But because of Michelle Obama's initiative about obesity in children and diabetes, there's been more research done on obesity in children and how the risks of getting diabetes.
Wow. So many things it affects. Obesity really affects your body.
Yeah, we discussed also that fat cells, they used to think that they were metabolically inert, that they did nothing, just sat there, and they just hung around your heart for fun. But what happens is that they release lectins and other biochemicals that cause inflammation. So these same children who are obese then get asthma, get other autoimmune problems, juvenile rheumatoid arthritis, all things that could be prevented if they exercised regularly and change their diet. But it's very hard for people who don't have a lot of money, especially if they're on food stamps, to eat fresh food, because they did a study where if you're in a lower income family, they did Google Earth maps, and we found that these lower income families had fewer grocery stores. Fewer Safeways would be placed there, fewer regular grocery stores. Instead, they had 7-Elevens. The 7-Elevens had no fresh food. They only had packaged food. So if you're a busy mother and father and you have growing children at home, little 7-year-olds or 6-year-olds, all you can do is go to the 7-Eleven to use your food stamps. That's pretty bad. You have no food choices.
Yeah, that's very bad. Wow. So how often do you think people who are trying to lose weight should work out?
They eat every day, so they should try to
Every day?
exercise every day. If you eat every day, because you have to, they more than other people, because they really have to work at trying to change the hypothalamus set point to a different point. So you have to engage your metabolism in a different way.
Wow.
How do you feel about diet pills and all those different things are people advertise now?
Yeah, like
Do you feel-
herbal
do you think those work?
medicines.
There's acupuncturist techniques. They think right by your ear, there's acupressure points. They put needles there, and people lose weight. That some people use that. Some people do hypnosis. The diet pills, some have been found to kill their heart and they die. That's bad. So some of those have been taken off the market. All the diet pills are a form of a synthetic, amphetamine to get you to, increase your metabolism. And sometimes they're not fully FDA approved because they're labeled as a vitamin. For example, Monster drink, that caffeinated drink, some 14-year-olds died. It was pulled off the market. And now they changed it. They just called themselves a cola. They don't call it an energy drink anymore. They just relabeled themselves. So it's very hard to lose weight, but that's why there's such an industry. Whenever there's so many brands to try to fix a problem, you know it's a very difficult problem. But once you get over the threshold, people feel good. People feel really happy about losing weight and keeping it off. So it's a tough problem, and the diet pills can be dangerous. Always ask your doctor about them. Call up the doctor's office, the nurse, read them the ingredients, Xerox the ingredient list, or Xerox the whole box with the ingredients and fax it to your doctor.
How many different types of pills, powders, smoothies are there to lose weight?
There's like thousands. You go to Whole Foods or to Safeway, there's always something. And then Midnight TV, they're selling weight loss. You
Yeah,
know,
I've seen the commercials. Wow.
like buy one, get one free.
Yeah.
For $9.99, we'll do this and you'll be transformed.
Yeah.
And then there's all those abdomen exercises that you don't
Yeah.
have to move, but they'll just clamp it on and they'll get. So that has been around for 40 years. They just change it every year. So people want to lose weight. People are concerned about it. They know it's bad for them, but it's a, you know, it's a tough thing.
Is it easier for men to lose weight versus women?
I think they lose weight differently because women after childbirth, they think that there's a time period when their thyroid is not active very much, and that time period can last all through breastfeeding. And so that's when a lot of women gain the weight and can't lose it. You know, you know, the child is 2 years old and they still have that pregnancy weight. And so men don't have that. They have different issues. They just have the beer belly and they just eat their steak. They have a different issue. So for women, there is a metabolic problem, and sometimes they don't address it. And now they're fancier testing to test for their thyroid abnormality after pregnancy. So it's important. So women, it's hard for women to lose weight because they have a metabolic issue. Also, estrogens play a role. So people on birth control pills sometimes feel bloated and they're a little heavier. And of course, smoking, if you quit smoking, there is a little time when people might gain weight, although if people are good about it, they don't gain weight.
I think women also like naturally have more body fat too.
Right, because of estrogen.
Yeah.
And it's very important that women, you know, give themselves the freedom to love themselves, to say it's okay.
Yeah.
I tried, I'm having issues, I'm on my journey to lose weight, it's okay. You know, you have good days and bad days, and if you keep going forward in this journey. It's very hard to lose weight suddenly. So
Yes.
people suggest that they think about maybe 2 pounds a week, 2-3 pounds maximum.
Yeah, I was going to ask you, do you think short-term goals are better than long-term goals?
I think people have to have both, and they have to write it all over. You know, this is my goal. And then, because to lose 3 to 5 pounds in 1 week is to exercise something like 500 calories a day. That, as I said, that's like 2 hours. We're talking major commitment. What can you do? Sit in a pool and swim for 2 hours? You might drown, become a whale, become a porpoise. It's, you know, very difficult.
Yeah.
And to do 2 hours in a day spaced over 8 hours, you have to quit work. This becomes your full-time job because it's very hard.
Yeah. Do you think it's better if people who are losing weight to eat 2 big portions of food a day or little portions throughout the day?
The diet specialists say change your portion size, eat smaller, and you have to do it gradually, and change your ability to kind of be satisfied with that. And that's almost convincing yourself. So then you have to substitute diet, cola, herbal tea, chewing gum, exercise, something where you're not near food, or do some activity where you're so far from food, like you're not near a McDonald's, you're not near the ice cream store, you're not near a candy store, and you're just far away, but engage in an activity you like, you know, something that really interests you.
So are you going to lose weight if you just starve yourself? Or
if you starve yourself, what happens is that, you know how some people fast and they're protesting some government program? So the first 24 hours, your body breaks down protein. So it depends how overweight you are. Obviously, if you're very chubby, you're not going to die because people in the developed countries, like industrialized nations like America, people don't really die of starvation. We're not in Africa. But you will change your dehydration status, so you have to keep drinking water and fluids. So people can fast, but it's not recommended by most doctors to do that, because if you change your electrolytes suddenly, it's not good for your heart. And you could do something not so good for the rest of your big organs that need to work.
Yeah, do you think like just cutting down calories is enough? Like, would that
Is
show
always
any results?
the first step of the long journey is the hardest. So cutting down calories is always something to aim for.
Yeah.
And if you're overweight, it's hard to run, hard to your joints aren't mobile. You're like carrying. It's like, imagine you and I carried an extra bunch of weight all day. We carried dumbbells of 20 pounds all day. It's hard for us to move. If we were carrying dumbbells, I couldn't walk so fast.
Yeah, it gets heavy.
Yeah, and then my joints would wear down.
Of course.
So what happens with people who are 65 and overweight, they get knee replacements because their joints have worn down and their hips from carrying all that weight.
Wow. Is it hard? I would assume that it's harder if you're more elderly and overweight to lose weight. How are you supposed to lose weight if, first of all, you're obese, two, you're elderly, you can't really walk. Let's say you have a hip replacement. Is a diet a little bit better than completely working out since you're not able to?
I think they have to do the diet, and they have to also change their exercise pattern. They have to sit in bed and do the dumbbells, do something. Well, we have like 30 seconds remaining. This is a great show, how to lose weight, feel happy, or how hard it is. And if our home audience likes this, call us at KSAR, make a donation, call us up. Our email will be there. And thank you for joining us.